From national to global, we're setting the standard of psychosocial care in oncology. Coming up next on Psycho-Social Oncology TV. Hi everyone, I'm Rhonda Craig with Psycho-Social Oncology TV, and for the first time ever, APOS and IPOS have joined forces for a truly historic World Congress of Psychosocial Oncology. Now, over the next couple of days, we'll be bringing you all of the highlights and insights from researchers, clinicians, and delegates from across the globe.
Because I think our conceptual model that we developed for our report was very important, which was having patients and their family members at the center of a high-quality cancer care system.
Dr. Patricia Gans kicked things off with a timely discussion on the challenges and opportunities for delivering high-quality, patient-centered care in the 21st century. Cancer patients often feel lost in the complicated and fragmented system. She told delegates they could do a better job of helping patients get through treatment by facilitating shared decision-making, improving patient and doctor communication related to the diagnosis, treatment, and prognosis, and ensuring they receive high-quality psychosocial and palliative care right from the beginning.
And the report really emphasizes the challenges or the crisis that we face, which is the aging of the population, the large number of new people who will be diagnosed with cancer in the coming years, that we have an aging workforce that's not always working together, that will be retiring, so we need to continue to train new people to meet those challenges, and also to work together collaboratively. The workforce itself doesn't collaborate, and often the patient has to be the coordinator of care.
The research that I do is really trying to look at how do you develop messages and technologies and decision aids for patients in a way that is helpful. So I think that her talk just kind of puts that into perspective of where that fits in the whole patient experience.
From world-renowned speakers to posters promoting the latest research, delegates were eager to learn about new initiatives and clinical interventions driving the field forward.
Any type of support that I can bring back to my nursing staff and just make them realize what's important. It's all patient-centered care, and this is why we do what we do.
More than 900 delegates from 49 countries are here at Congress. It's the only place to connect with peers from across the globe and hear world-class educational content.
It's an international conference, and you get an opportunity to interact with everyone around the globe. And it's a very important networking also, you see the pioneers in this area, you see the people who are done a lot of researches in the area. So it gives you a lot of ideas.
I want to know the new development of psycho-oncology in the developed countries.
This session discussed the importance of distress screening for cancer patients. APOS and the Association of Community Cancer Centers worked together on a project to identify 3 model programs that could serve as resources and provide best practices for other sites. Panelists identified successes and challenges associated with distress screening using paper and pencil methods, as well as integrating these tools into an electronic health record. While each organization has to decide what works best for them, panelists hope the findings will help providers see distress screening as a means of improving patient care rather than just a mandate.
We can't answer all the questions. The questions we have is, this is how 3 sites do it. And what we're hoping is that other sites around the country that might be struggling with the implementation can take some ideas from how these 3 sites are doing it. Currently, a white paper is being developed that will be not only available to anybody that wants it, but it'll be put online. And in those ways, we are expanding the knowledge of all cancer programs, not only in the United States, but because it's online internationally.
During this session, experts provided a global overview of various challenges and stigmas associated with cancer and its treatment. The IPOS Human Rights Task Force has been working since 2008 to ensure that psychosocial care is recognized as a human rights issue. Today, delegates learned details about the Lisbon Declaration, which advocates the issue and enhances the IPOS International Standard of Quality Cancer Care. The goal is to have the declaration endorsed by 300 cancer organizations and have the World Health Assembly pass the resolution. Attendees were encouraged to sign the declaration and be prepared to work directly with their member state delegations.
So the goal would be to have our Federation member societies be able to utilize this same argument and have all of the assets of materials that we develop and the weight of the Lisbon Declaration, a World Health Assembly declaration behind them when they make these arguments to their ministers of health, their government officials, etc.
For more information or to sign the Lisbon Declaration, visit ipost-society.org. Well, it's been an incredible day of content and connections, and we encourage you to share all of your personal findings and highlights on social media using the hashtag WCPO15. For now, I'm Rhonda Craig with Psycho-Social Oncology TV. We'll see you tomorrow.